Je veux là aussi saluer et remercier de l'honneur, l'amitié qu'elle nous fait d'avoir accepté notre invitation, le professeur Mjk Eng de New York. C'est dans le monde de la dictologie une personnalité extraordinaire, presque mythique, et elle a participé, elle était toute jeune, aux travaux de l'équipe pionnière, fondatrice, avec Vincent Dole et Marie Nisvander, à la découverte des propriétés thérapeutiques dans les addictions de la méthadone.
What a pleasure it is to be in Biarritz. I have never been here before. I have been to THS 3 times, in 95, 97, and 99, in the south of France. And I find that the meeting now has grown and matured to a very exciting one that balances science and clinical research with humanism and concern for the patient and concern for society as a whole. I do not wish to put down the early days of THS when this organization was new and I came to the 2nd, 3rd, and 4th meeting. It was unbelievably courageous. France had only recently accepted the concept of pharmacotherapy to be combined with behavioral treatment for addictions. Methadone and buprenorphine had just been introduced in the early 1990s after many discussions about this. And the concept of putting together both physicians and others concerned about treatment of addiction with those concerned about treatment of hepatitis, primarily C, but also B and Delta, and HIV was extraordinarily courageous and very important. Our job is not done. We have possibly the most stigmatized of all the disorders, the addictions, grouped together with possibly the 3rd most stigmatized, AIDS. And hepatitis would be stigmatized if the world truly understood that most of our patients were sometime drug users, not necessarily addicted, but drug users, but they were. And we know that the epidemiology of hepatitis C, and to a lesser extent the epidemiology of HIV, are involving intravenous drug use as well as cocaine use and other drugs of abuse, which change behaviors and or actually offer parental introduction of virus, critical for C. So I think the meeting is extremely fine. I thought I would share with you tonight some of the early facts about treatment. Vincent Dole was a metabolism expert at the Rockefeller Institute for Medical Research. He did volunteer work on the Health Research Council of the City of New York. And they identified that the #1 problem in New York area not being addressed and not being carried out with research was heroin addiction. And in the summer and autumn of 1963, Professor Dole decided to change his laboratory from studies of metabolism and hypertension to look for a new approach, a pharmacologic approach for treatment of addiction. And with the permission of the president, Det Bronk, and the head of the hospital, Dr. Macklin McCarty, one of the original discoverers of DNA, he changed his work and the name of his laboratory, and he recruited 2 new staff members. Now, this is a piece of history that is not well known. I didn't join the team of Dole and Niswander. Niswander and I joined Professor Dole. We were both recruited in the autumn of 1963. Marie was a psychiatrist who had been working both on the streets of New York, the hospitals of New York, and had spent some time working at the United States Public Health Service Hospital in Lexington, Kentucky. She worked there but was disappointed because they were not looking to treat addiction. They were looking at Lexington to develop a non-addicting pain medication. She came back to New York, wrote a book which was entitled The Addict as a Patient, which I commend to you all. And Vince read that book and asked to meet her, met her, interviewed her, recruited her, and 2 years later married her. I was across the street at Cornell, New York Hospital. Vince wanted very much to have 2 young people work with him on his team, in addition to a psychiatrist, Marie, who knew something about addiction. The chairman of medicine said he couldn't allow 2 people to go, but he would allow 1, and all of the house staff wanted to go to do research at the Rockefeller University. To be very honest, I'm not sure we even understood what the topic would be, but we all decided that we would like to be there. Vince Stoll interviewed each one of us and selected 2, and the chairman of medicine selected me because I was a woman, the only woman on the house staff back then, and I would not be drafted. Now this actually is an archival picture, and many of the comments and slides I'm presenting you today, I presented a year ago at a much sadder presentation. It was the memorial for Professor Dole, who had died a year before that. This is Vince, Marie, and myself in '64. And I think in retrospect, probably the most important thing we did at that time was to change the whole concept of addiction, change it to formulating the idea that addiction is a disease, a metabolic disease of the brain, but causing drug hunger, drug craving, and drug self-administration, and that addiction was not simply a criminal behavior or weak personality disorder. Although there could be comorbid conditions, it was driven by the drug interacting with the brain and changing the brain, our early hypothesis. And the early chronology of our research began in January of 1964, conducted at the Rockefeller Hospital, and in the first 6 months, we actually had a proof of concept. That is, that one could use a pharmacotherapy with what we guessed was an opioid receptor directed, but didn't know then because opiate receptors had not been identified and were not to be definitively until 1973. But we wanted a medication directed at the same place morphine went, then heroin went, and we called that the opiate receptor. And we wanted a medication that would be orally effective, so there were no needles required, and that would have a long duration of action. At that time, methadone had been studied by 2 sets of groups. One were pain studies carried out by Beecher up at Harvard and Hood at Memorial. And they had both intriguingly found that if methadone, which had been brought back by the US military from Germany, made by the Bayer Aspirin Company, when they studied it in opiate-naive individuals, they found that pain relief occurred for only 6 hours. But if they gave 3 or 4 doses a day, like you would with morphine, respiratory depression would occur in the opiate-naive individual. And then, and now this many years later, I will say that I think our FDA and every FDA equivalent should say never give methadone to an opiate-naive individual. Give it to persons that have experienced opiates either for management of pain or for the treatment of addiction. not to be discussed at this meeting